Hello, this is Just Listen, hosted by George. Today is December 15th, 2025. Guess what? We're closer to Christmas, so I really hope that everybody is enjoying their holiday season. Hope so. Today I want to talk about the U.S. federal government policy on health care cost. As you are aware, unless you've taken a break from watching the mainstream media news shows, that is front and center in Congress now about these Affordable Care Act subsidies that meaning Congress, wants to save. Now, I think that it's always important to have background. So I'm not going to bore you. Just give me a couple of minutes to set the table for what the critical issues are with healthcare costs. And some of these might even surprise you. Okay, so we're looking at costs. So the policy is driven by a mix of direct spending, which is Medicare and Medicaid, subsidies, the Affordable Care Act marketplace tax credits, regulations, Affordable Care Act rules, and surprise billing. Now, I'm not going to focus on that because some of these are actually programs into themselves, and I don't want to come across like I am an expert on healthcare policy costs, but there are a couple of things that you need to know to talk about with policy. Now, President and Congress, their job is to have ongoing efforts to control rising prices, particularly for drugs and hospital services, through measures like protecting competition and negotiating prices through significant partisan differences exist in approaches, right? So we know about the competition, and we also know about the prescription drug pricing. That has been front and center. And I'll tell you why I think that that's an important thing to talk about in a couple of minutes here. So the policy differences for the President and Congress is focusing on market-based versus direct regulation solutions. Now, what that is talking about, the Republicans want market-based. The Democrats want direct regulation securities, which basically means that they want to be able to tell the pharmacy companies, insurance companies, hey, it can only be this price. Okay, key areas to focus include reducing prescription drug costs, controlling Medicare and Medicaid growth, and making private insurance more affordable through subsidies and market rules. Now, that was a mouthful. So follow me for a few more seconds and then we're really going to dive into it. Key federal policies for the cost. The Affordable Care Act is actually mandates subsidies like tax credits and cost sharing for marketplace plans, regulates insurer practices, and implements employer mandates to encourage coverage. Also, the next one, Medicare and Medicaid, major federal program setting payments standards and covering large populations with their spending growth significantly influencing overall budgets. Drug price negotiation. The Inflation Reduction Act allows Medicare to negotiate prices for some high cost drugs and a significant shift to control costs. Now, I said a lot. I did a lot of definitions. Here's the bottom line. I was in the military 20 years. I had health care, and I never had to negotiate my care. I didn't have to negotiate prescription drug costs either. Now, you could say, well, you were younger then, and you didn't need as much medical care. Under the Affordable Care Act currently, young people can be in that. And what I just read you, it says that if you're in the marketplace, part of that is the system is supposed to help you negotiate cost for, say, like prescription drugs, and that is a dynamic of your coverage. Why is that? So let's move to the next group. So currently, and I've talked about this before with FPL, the federal poverty level calculation that Congress came up with, and I'm not even sure when they even did this, because that is the policy that controls if you're even eligible for it. And like I've talked in the past, the Affordable Care Act is strictly for people who are not working, no matter what category you're in. And if you make under $40,000 a year, pretty much. Now, what they did do is they created another law slash act where they included people in the middle class. And this is when they started doing the federal poverty level stuff to make other people eligible so that they would get enrolled in the Affordable Care Act. And they've made it very complicated. I mean, quite honestly, it's hard to even speak about it without having 4 years of college just in that. But getting back to my example, when I retired from the military, I was in my 50s. Okay. I worked for the federal government again, and also as a government civilian. I think that my experience is what yours is, even if you work in the private sector. When you work for a company, the conversation has never come up that I have to negotiate my premium, and if I need pharmaceutical products, that I have to negotiate that as well. So why is that in the Affordable Care Act and all these marketplaces and all of these different stipulations of when you can't make that money? And the root problem in this one that I keep seeing is you have to qualify. Well, if it's a federal government run program, if you are working, for example, why would yours be so much more when it's funded with $50 billion? Now, I also looked up the criticisms of the Affordable Care Act. Increased costs and financial burden, higher premiums. While the Affordable Care Act has made insurance more affordable for low-income individuals through subsidies, many middle-class Americans have faced significantly higher premiums and deductibles. That's what I was talking about. So if I'm looking for a job, I'm going to look for one that gives me the health care benefits just so I'm not worried about having to be in the Affordable Care Act. And then I'm negotiating prices, the prescription drugs would be significantly more. And oh, by the way, if I'm a senior that's retired, this seems like a nightmare with Medicare, Medicaid, and then since the government is subsidizing it, all of a sudden now everything doubles. And then you get the soundbite of, well, there's going to be 40 million people taking off and they're suffering. They don't have anything else to go back on. The poor people are covered on this. It's the people working, making a little bit of money, who I see as, based on the data, they get punished. Higher premiums and deductibles. The affordability gap would be the second one. It's been noted where people with incomes just above the subsidy eligibility threshold face high unsubsidized premiums, making insurance unaffordable by the Affordable Care Act's own standards. Now, that ties in with the other one, the higher premiums. Now, here is the bottom line. It looks like, based on the data, that they open this up to include people in the Affordable Care Act so that they can pay higher premiums to cover the people who aren't contributing anything in this system. Then the next thing they've done with it is burdens on young and healthy individuals. So the Affordable Care Act's rule capping premiums for older enrollees at only 3 times those of younger ones forces younger, healthier individuals to pay premiums that exceed their expected health care utilization. Increase national health expenditures. Critics argue that the law failed to bend the cost curve on national healthcare spending toward downward instead of total national health expenditures, and has continued to make everything rise. Now, we're looking at costs. So 2 quick examples. Prescription drugs. We've heard the president and the previous president talk about, on some of the high cost drugs, they have to regulate it to keep the prices from being high. So I'm assuming that it's like dementia drugs and stuff like that. Now, I would think if you qualified for these drugs, isn't that what insurance is for? Why would the person, if I'm working for a company, why would I have to negotiate the price of a prescription drug? Okay. Now, as you get older, you need more prescriptions. Not so much when you were younger, but the bottom line is there has been a bureaucracy created with the Affordable Care Act and health costs in general. And it looks like, based on the data, that when they enacted this in 2010 and they started funding it, insurance companies, people selling pharmaceuticals said, okay, now we can raise the prices and get the federal government and taxpayers, these are taxpayer dollars, to go into these programs, and we can make it the most expensive thing that you've ever seen. Because like I told you earlier, in my work life, when I had a job where I have health care, none of these issues come on up. And unless behind the scenes, the corporations are dealing with the same thing, well, then they need to speak up because regular people who are trying to work, raise their families, pay taxes, this does not seem, based on the data, a good program that people need to be involved in when they are paying for it? This is Just Listen, hosted by George. Let me know what you think. I went a little bit over on the time, but that's only because this is an important subject. Have a great rest of your day.